Pagpapatuloy po natin ang ating topic, auditory diagnosis, hiccup, o sa Tagalog po yan, sinok. Hiccup. Hiccuping occurs when stomach qi becomes rebellious and start to ascend. This may indicate that there is a excess condition, such as stomach heat, stomach cold, or liver qi invading the stomach, in which case the sound hiccups will be loud. The stomach can also be too weak to send its qi downwards. Example po yung stomach qi, pag nag-deficient or stomach qi deficient, in these cases, the sound of hiccups will be weaker and more subdued. So, ibig sabihin po pag deficient, yung pag sinok din natin mahina. Definition: reflexive spasm of diaphragm accompanied by a rapid closure of glottis produce an audible sound. Hiccups can occur alone or as part of some other condition. So, pathomechanism: stomach qi rebellion causes an involuntary spasm of diaphragm and glottis. Many factors can contribute to this condition. Hiccups can be classified as excessive or deficient. Excessive conditions are due to external or internal pathogens which accumulate in stomach and obstruct the descent of stomach qi. Deficiency of qi or yin causes the stomach qi to lose its power to descend, which causes an accumulation of qi that rises in the form of hiccups. So, ayun po yung ating diagram, paano nagkakaroon ng hiccup. So, kung may improper diet po tayo or may emotional stress, so from food or yung qi, nag-obstruct po siya downward flow. Then, the stomach qi magre-rebels. So, magkakaroon ng spasm, then magko-closure yung glottis at magkakaroon ng hiccuping, sinok ng sinok. Then, pag may chronic illness naman po or weak constitution, yung lalo pa affected yung ating spleen and yung stomach qi natin ay nagdi-deficient, so or stomach deficiency, magkakaroon po siya ng lack force for downward flow. Kaya pataas po yung flow ng energy, magkakaroon ng qi rebellious. Magre-rebel yung stomach qi natin. So magkakaroon uli ng spasm, then closure ng glottis at magkakaroon ng hiccuping. So clinical significance po, the sound of the hiccups enables one to distinguish whether it is symptom of heat or cold, excess or deficiency. So yung hiccup sound po, pakinggan po natin ay yan, sa pamamagitan ng pakikinig, pag acute onset po yung pagsinok, pag loud po at saka high pitch, forceful and consistent sound, di ba yung sinok ng yung gumaganon po, pwede po siya deep, slow and forceful sound which may be relieved by heat and aggravated by cold. Ito po ay indication niya ay mayroong cold attack the spleen and the stomach. Then pag frequent attacks that are induced by emotional stress, loud, sonorous and clear sound, so liver fire attack stomach. Then pag loud and clear sound, rushes out from the throat with a strong or full sound. Alam po natin pag full is yon, stomach fire. Chronic onset with low, weak, and intermittent sound. Short and intermittent hiccup sound with recurrent attack. Yung po ay deficiency, stomach deficiency. Pag weak sound, low volume, intermittent, chronic, spleen and kidney yang deficiency po yan. Pag critical patient suddenly hiccup, which is weak and interrupted and recurs after a long break, so ang ibig sabihin po nun ay exhausted na yung stomach qi niya. Yan po yan ang hiccup and its indication. Hiccup with a loud high-pitched sound indicates a full condition and often hit. This type of hiccup may be due to stomach qi revealing upwards, stomach heat or liver qi invading the stomach, infrequent hiccup with a deep but strong sound may be due to cold in the stomach. Infrequent, weak hiccup with a low sound indicates stomach deficiency. Pag frequent naman po but weak hiccup, so stomach yung deficiency din po siya. Minsan pag nagsisinok, hindi natin alam kung saan ipipressure, ano? So ito po, pwede natin kung walang needle, syempre pwede po niyang i-pressure para tumigil yung pagsinok. REM 17, pericardium 6, and stomach 19. Pero naalala ko, Dok, yung mga matatanda, nilalagyan di ba yung baby ng papel sa may noo pag nagsisinok? Pero natatanggal din naman, ano? Nape-pressure yata kasi nila yung points dito. Kaya natatanggal. Cold in the stomach. So, ang pagsinok po nila ay forceful. Then, nagkakaroon din ng nausea, feeling worse after swallowing cold fluids. O, masisinukin siya kung may malamig siyang nainom. Which are quickly vomited. Then, may severe pain sa epigastrium, feeling of cold, cold limbs, preference for warmth, vomiting of clear fluid, which may alleviate the pain. So, ang preference po niya ay warm liquid. Then, thick white tongue coating po ito. At ang kanyang pulse ay deep, tight, slow. So, dahil po yun sa lamig sa bituka. Cold in the stomach. Pag stomach heat naman po, ang kanyang pagsinok ay forceful. Then, may sour regurgitation. Then, burning epigastric pain. Meron po siyang thirst. Merong nausea. At pwedeng excessive hunger. May full breath, feeling of heat, red tongue with a yellow coating, overflowing rapid pulse. Pag stomach qi deficiency naman, ang hiccup po ay weak, then infrequent with low sound. So uncomfortable feeling in the epigastrium. No appetite po yan, lack of taste sensation. Then loose stool, may tiredness, especially in the morning. Weak limbs po yan, then pag tinignan ng tongue ay pale and pulse ay empty. Pag stomach yin deficiency, weak hiccup po. Wala po siyang gana or slight hunger but no desire to eat. Meron siyang constipation, nagda-dry stool po yan. Then dull or slightly burning epigastric pain. Dry po ang mouth and throat, especially sa afternoon. So, thirst but no desire to drink, or a desire to drink and a small sip. Slight feeling of fullness after eating. Normal color po yung tongue coat without coating or without coating in the center. So, pag tinignan yung pulse ay floating empty. Pag ang hiccup ay due to liver qi invading the stomach, so pronounced hiccup po yan. Then meron siyang sour regurgitation, feeling of burning in the stomach, coming in both belching, irritability, epigastric and hypochondrial distension, and pain, feeling of oppression of the epigastrium, belching, nausea, vomiting, sighing, weak limbs, normal color po yung ang kanyang tongue, or slightly red on the side in severe cases of liver qi stagnation. So, ang kanya pong pulse, wiry sa left and weak sa right. If the hiccups are due to spleen and kidney yang deficiency, so incessant hiccup po yan. Lower back ache, meron siyang cold and weakness feeling. Then, feeling of cold. Ang kanyang pong complexion ay bright white. At pwede siyang impotence, decreased libido, tiredness, lassitude, abundant clear urination, urination at night. Meron din po siyang loose stool. Then poor ang kanyang appetite, slight abdominal distension, desire to lie down. Early morning diarrhea, pale and wet tongue. Ang kanya pong pulse ay deep and weak. So, yan po yung mga sinok. Thank you po for your attention. Maging